Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. We have Stacie Ruth with AireHealth with us again today. If you might recall, we had Stacie on the show, about 6-7 months ago?
About right, yes.
Yeah, and so we welcome you back.
Thank you so much. I'm so happy to be here from home, as we can see.
Yes. So I was hoping, I wanted to get you on the show again and talk about where have you been the last 6 or 7 months, what's been happening. And then I think, just with everything that's taken place with COVID, it would be really good for us to, pivot our conversation into what's happening now. So I think if you could give our listeners just a little bit of an update on what's transpired since we had you on the show last, and then we'll talk about what's going on now.
That's awesome. So I'll just remind you that AireHealth is a respiratory care company. We are focused on delivering respiratory medications through a nebulizer. And we've also developed an application, a companion application that allows either a patient or a caregiver to really monitor the status of, say, an asthma patient and be able to react more, we'll call it actually more proactively than reactively, and to focus on the different things they can do to monitor their symptoms and alleviate those symptoms with medication. So that's where we were. That's where we are. However, since we last spoke, we have released our product to market. We have released our application to market. We have our first customer, which is Advent Health here locally in Orlando, Florida. Thank you. We kicked off a pilot with them, and we're focused with them on the pediatric space. And that pediatric space allows us to look at least 50 caregivers and their children that have asthma, and that's kicked off quite nicely. So now fast forward, and as of the last 4 weeks or so, we've really been in a mode where we've been thinking about, okay, so we help people with respiratory conditions, and we know that that's a strength of our company. We had just launched a product, which, you've got some choices to make.
Yeah.
Do you keep going on the path that you were on, or do you try to pivot, if you will, using that word, and you find something where maybe you can help more people faster than you were planning to before, and that's where we are. So I'll give you more information about the way in which we've pivoted, but I'll let you ask the questions as you want.
Yeah. So I think that that's great. So one of the things that I've had conversations with innovators with is, I see that there's varying degrees of this interest in pivoting, in the sense of that, I don't want to just take advantage of, what's happening with COVID. And I think that the conversation really has to be, it's not really taking advantage of it. It's more of, we have a social responsibility to help people in a different way than we were before, because needs have changed, priorities have changed, and a different set of lives are at stake. And so I can only imagine the additional burden and responsibility that you feel being in respiratory care and what's happening. And so let's talk about what are some of the pivoting decisions that you're making, and some of the things that you were kind of debating back and forth, wrestling with, and then kind of talk about where you landed.
Yes. So in the first, we'll call it the early days, the first couple of days that we saw there was a national and an international emergency or a crisis coming on, and that it was going to affect respiratory care. The very first thing I said was, hold off. Let's listen before we talk, and let's understand if it is appropriate for us to enter into the conversation. So the first thing we did was we waited a couple of days, not long, but long enough to listen. The second thing that I made a decision about very quickly was that we were not going to insert our brand in and our product capabilities in from a basis of fear.
Right.
So we were not going to create fear and uncertainty around the conditions that the people that we're serving with our products and solutions. We were going to come at it with, if there's a place for us to help, we will help. And if it's creating more fear or more concern or inaction, be terrible if we were creating inaction or confusion, then we were not going to engage in the conversation, nor will we try to be the people that were solving the problem.
Yep.
So that's where we started.
Mm-hmm.
And then we said, okay, from a place of empowerment, from a place of having the patient do more for themselves, especially if they're a respiratory patient, yes, we have something to offer. And we pivoted very quickly. And when I say quickly, I've never seen anything like this before. We literally said, okay, what is the one thing we can do with our existing cleared product, our existing capabilities? What can we do to pivot? And we said, okay, we have to be able to manufacture faster if we are going to help more people. So we immediately started a change in manufacturing strategy, a change in supply chain strategy.
Yep.
And big deal, right, for a small company. But we started that first. And then we did a regulatory assessment that said, if we were to move from, say, a product that lasts a year to a product that we want to shift over and have disposable so that it's very clean and very safe for a respiratory user, what would it take from a regulatory perspective? Then we put on our regulatory hats and we determined what we would do.
Yep.
Okay. From there, we said, we don't want to do it alone. So how are we going to ask for some helpers? And we put an innovation plea, an open innovation plea out into the world. We started with a very simple post. It linked you to a site with a video and a clear explanation of how we were wanting support from the outside world. And we just said, come one, come all, and they have came. They came with, there's been a lot, okay? And truly, it's been a lot of helpers. And you know the Mr. Rogers saying about his mother told him, when you're ever scared, you just look in the world for the helpers. We have seriously found some helpers.
That's wonderful. And so what are you guys doing? Like, what are some of the things that they're helping you with?
Yes, so we looked, our appeal looked at 4 different types of helpers or collaborators, if you will. And again, with an open innovation mindset. So this isn't how do we turn this into a business and focus on profitability right now. This is how do we, by summer, and we put a goal in our appeal, by summer, launch something that makes an impact against COVID. So what we knew we could do was create this disposable product and to scale up manufacturing. We also pivoted by changing our application from an asthma caregiver, right? This is a supplemental application we're building. We shifted over with new customer requirements that had to be done very rapidly. Okay, we didn't follow the perfect process.
Cycle innovation.
Rapid. Okay, and we have shifted over to redesigning and redeveloping a COVID feature focused app. So the appeal was like this. We said, we have a drug delivery device. Do you have a novel or existing drug targeted toward respiratory patients, right, that you believe should be administered in the home? That was the appeal there. Do you have does someone want to work with us that has a drug, a biologic, a generic that's already being delivered by a nebulizer? The second thing we said was, in the ecosystem, are there marketplaces, are there platforms that either call themselves device aggregators? The other word we use were virtual care platforms, and of course telehealth platforms, because you don't quite know how they're positioning themselves. But if you have a platform and you are able to accept customers like us onto your platform, please come talk to us. And there's been 4 in that direction. Fantastic traction there. One drug, by the way, 1 drug, 4 platforms are in the mix right now.
Yep.
The third thing that we said was, are you capable of scaling manufacturing extremely fast? And if you are, do you also have reach into distribution? Come talk to us. Okay. And then we actually added a 4th, which was, there's actually 5 if you add the last one that I'll talk to you about that we're doing on our own. But the 4th was, if you collaborate with others, so are you an accelerator, an incubator, an online platform like HealthBox put something together where
Right.
your ideas can be funneled in with other ideas, please allow us on your collaboration site or on your collaboration network. That's going well. Now, how we're contributing is the biggie. What we've done is we've said for any of those other partners, we will work as hard as we can until summer to bring as many devices, algorithms, sensors that are either cleared, exempt, right? Or that we can take it and make it a little less clinical, a little more informational, and we'll put it in the app for you.
That's huge.
So those are licensing agreements that we're working on right now. So that's where we are. So we're taking our own technology and enhancing it. We're scaling up our own operations in order to satisfy a much larger need as far as equipment is concerned. And then we're asking for helpers to help us be able to create a more robust solution and get it to the world faster.
So how do you think asking the world for input and collaborators has changed or altered, influenced your pivot strategy?
So we knew from the beginning we were too small to do this alone, right? And quite frankly, we didn't want to do it alone, right?
Right.
There's a lot of good that can come from sharing, okay? So we also knew that we wanted to approach, I mean, there's a lot of stimulus right now going on, and that we wanted to approach some of this innovation-related stimulus. So for example, there is a part of BARDA, which BARDA is the biomedical arm of HHS, which is a countermeasure. Okay, so when there's something biologic or pandemic, there is a countermeasure process in the government that says we'll help you fast track, we'll help you fund, and we'll help you find other collaborators if you are a medical countermeasure to a known and declared emergency.
Right.
We're approaching that, okay? And what we've done is we've hired someone who helps from that perspective to help us understand not only how do we best position our own company, AireHealth, as a medical countermeasure, but how do we source and find other partners that when we put our capabilities together, we have a stronger chance of being able to approach BARDA and say, this coalition, this collaboration group is ready to approach you, BARDA, with a solution that we believe we can have out by summer. So at first it was, whoop, can't do it alone. And then it was, oh, this is going to be good, right? And then it was, look at all the opportunity that gets opened up if you'll just take an open innovation and partners approach to solving the problem.
I love it. Brilliant.
Thank you.
Brilliant, brilliant. So let's talk about what are some of the challenges that you faced over the last 4 weeks?
Okay. So we were already running on a startup's investment budget, right? And, you know, you start to get concerned about what if we end up with we have a team of 9, what if we have a team of 9 and we don't have a team of 9, right? What if for some reason someone needs to take time off or there's a complication that we need to work through? Yep. And so the very first thing was get our house in order, ensure that we could make it. Let's just be frank about it. We're an early stage startup. Be sure we can make it out the other side of this pandemic as a functioning and growth oriented company. That was plan 1, and that took 2 of the weeks. Okay. A lot of my attention went in that direction while my very capable team worked on many of these other things that I mentioned. Sure. So that I got the house in order so that we could ensure that
which is critical.
Yes, when we come out the other end, there was a foundation there that left everything we're going to do to accelerate. It left it a runway to accelerate from. If you can't take off at the end and you're starting over again building your runway, not a good plan. So that's why
I love that you paused, if you will, maybe not your entire team, but you yourself, and dedicated focus to that. Because a lot of entrepreneurs, you know, obviously a lot of us wear multiple hats, and we in we do. And, we can try to run those parallel. And so it's really hard to focus on what you need to focus on if you're still trying to figure out how long is my runway. And so pausing and figuring that out so you could focus on that and then focus on the other it's critical.
Yes, absolutely. And we closed investment during this 4-week period as well. So there were of course, that we were really far down the line there, but I think it was also the understanding of the investment community that AireHealth has a plan, right? There will be continuity of business. There is a strong leadership team in place. Yeah. And so that mattered. So that was the first big hurdle. The second was, when I talk about ramping up a supply chain and the manufacturing capabilities, that is something that takes a lot of manpower. All right. And we're very lean on manpower. And that's not the type of thing you can outsource.
Right.
To someone, right? I mean, there's lots of things you can get some help with and support with. Starting over on a contract manufacturing strategy is not something you take outside from the day that you go, can we do it? Should we do it? Those are internal discussions. So that did take quite a bit of work, and we're still in the middle of that. Mm-hmm. But we did have one of those partners when we put the appeal out. We did have some contract manufacturing capabilities step forward and say, we're in the same boat you're in. So what can we do to help you this year to get you off the ground? So the appeal is working.
Hey, it's Dr. Roxy here with a quick break from the conversation. Do you want your innovation to succeed, to change lives, to shape the future of healthcare? I want that for every health innovator, which is why I invented COIQ, an evidence-based framework to take your innovation from an idea to startup to full market adoption. If you're not sure where you are in the commercialization process, take the free assessment now at drroxy.com/score. Don't miss out on impacting more lives just because you have a low COIQ score. The free assessment is at drroxy.com/score. That's drroxie.com/SCORE. And now let's jump back into the conversation. So wisdom for all of our listeners: appeal, appeal, appeal. Don't be afraid to be transparent about what you need and open about what you need, and bring others into the conversation, especially when you're trying to do it fast, right? Because you don't really have time. None of us have the luxury to kind of, piddle around for a couple of months to go, oh no, we need help, right? We don't have the luxury of that time loss.
Absolutely. And the things that I would say that you don't want to lower your standards on, there's collaboration, but don't give your business away. Yep. Okay. Don't sign on balloon or back end heavy obligations for yourself. Be smart, right? Just because help is coming, it doesn't mean you're not paying for it somewhere. Okay. So I would just be smart and think ahead 3, 4, 6 quarters. And what is this going to do in the long term, and start getting that on paper, right? Be sure that you have the right capital strategy to accompany it, right? Yeah. And the second thing that you cannot be weak and you cannot be lack confidence in is you better have your IP strategy locked down. When I say open innovation, I don't mean, let me give you all my stuff and then you figure out what to do with it, right? I'm saying you go, here's my stuff, and for this particular field of use or purpose, here's how we're going to use it together. Right. And your rights stop and my rights stop, right? So this is very much about putting things into motion, but please, the second part of that appeal is don't overcommit or balloon yourself too much, and then don't let IP be one of the things that you let fall through the cracks, because you're diminishing value in your company.
And I think that's really important for us just to pause and talk about, because, it's not going to benefit you in the long run if you save your company for the next 30 days, right? Or the next 60 days, only to figure out that, in 6 months from now, you really have a hot mess. You don't have a business. Somebody else has your business, right? Yes. Golden handcuffs, right?
Yes, absolutely. So, I mean, the financial term would be accretive. You just be sure that everything you're doing is accretive to the business. It's not, we're doing something in a snap, right? And
Yep.
so we're going to let some of the future value of our company be in question. No,
Hmm.
everything we're doing at AireHealth is accretive.
Yep.
Everything we're doing is either pulling in something we would have done already,
Hmm.
or it's accelerating us in a direction that requires a partner to take us there.
Yep.
We've been very careful about the accretive nature of what we're doing, and people should really stop and think about it.
Hmm.
Yes, you're asking for help. You're not asking for help at any cost.
Yeah. And that's really important too, because, I was reading this article about the difference between a bull and a bear market. And, there's a lot more leverage that, especially when it comes to investors, there's a lot more leverage that they have right now in a lot of ways at this point in time that we're facing. And so I think all of our listeners really need to heed that sometimes nothing is better than something.
Yes. And I would say that, so probably so, because I would say that the market has been in the company's favor, in the startup favor, right? We've been, because the pendulum just swings back and forth, and maybe this is a reset more toward the middle, I hope, and that it's
Yep.
not so one side or the other.
Yeah.
But that's also something to look for, is where are the investors stepping up and saying, I recognize talent when I see it.
Hmm.
I recognize the ability to actually have business continuity when I see it. And
Hmm.
I recognize when people are marching toward that accretive value or increasing the value of the company by what they're doing. So that you got to look for the right partners, even from an investment standpoint right now, not folks that are looking for a deal.
Yeah. Yeah. Exactly.
Yeah.
So one of the things that I kind of hear you touching on is another concept that I was reading about in the last few weeks is investors looking for opportunities that are COVID proof. So it doesn't necessarily, I don't think that anybody's saying that it's a guarantee that you're going to grow, that you're going to survive, or that you're going to thrive during this pandemic, right? Nobody can have a crystal ball and know how this is going to all pan out. But at the same time, you described, I think, a lot of the elements that are really important to, and how you're presenting yourself to some of those investors, and is that your business is COVID proof, where you've got the business continuity, you've got the intelligence, you've got a lot of these things that you just described. Talk about that for just a second.
Yes. So I'll talk about what we didn't pivot, because that's the important part to understand, is we are still focused on the respiratory compromised human
Yeah.
at the other end of our solution.
Mm-hmm.
We didn't pivot the I guess we'll call it segment, or whatever word we want
Yep. Yep.
to label it. We didn't resegment. We still are focused on respiratory compromised people.
Mm-hmm.
And there's still 100 million of them, regardless of whether COVID creates another 5 million people that maybe now have some difficulty with their lungs that didn't, regardless if that is or isn't the case in the end,
Yep.
right? Or when we're through this cycle of what's happening with the pandemic, we are still focused on the 100 million people that have some trouble with their lungs. So that's very important to note. It's what we didn't change.
Mm-hmm. Yeah. And I think that that's really important too for any of our listeners, is that, each innovator is going to have a different pivot opportunity and a pivot strategy. And there'll be some things that they're more open to pivoting, and some things that they're like just non-negotiable. This is who we are, and we're not changing that. And I think that that's really important to define that up front. And as you're working through that strategy, otherwise, depending on where the company is, there could be this sense of desperation that leads the company to pivot in some areas that not only do they not own the company, but is that a possibility? But also, I own the company, but now I'm in this completely different business, and how the heck did I even get here?
Yes. Yes, I would just say to be sure and check that there is a market for your solution in September. Right? Do the September check and be sure that a pivot doesn't mean that there isn't, that once COVID's relaxed a little bit. I don't know if gone's the right word. I mean, I'm not a immunologist or a infectious disease person, but once it's waned a little bit, make sure that you still have an offering
Yeah.
and a very clear direction on who your customer is and how you're serving that customer. That we don't get a pass on that. Even if
Right.
you have a fantastic 6-month strategy, there still has to be a customer in September.
Now that's one way you can COVID proof your business, right?
Exactly.
Oh my goodness. So let's talk about kind of just go back in time a little bit when, so you and I were supposed to speak together at a couple of sessions at the HIMSS conference, which, gosh, doesn't it feel like that was years ago?
It actually does feel like it was last year, but yeah,
It was just last
that
month.
wasn't even a month ago, but okay.
That is crazy. When what is it like? And I think a lot of our listeners will be able to just really empathize with what that was like for you. But what was it like when you first got the messages that HIMSS is canceled and the South by Southwest is canceled and all these other conferences? So let's just talk about that experience a bit.
Yes, we were headed to both. We were invited to South by Southwest for a special invite-only pitch for companies that sell to children's hospitals. So that was a very special invite, and that one probably hurt as much or more than HIMSS. But HIMSS was a big launch for us. So HIMSS was a very market-forward opportunity.
Mm-hmm.
And the opportunity there to take the stage as well, because we were invited the top 16 by Venture Connect to do a pitch during the startup day. So you and I were going to talk about the work that we did last year, which was fantastic work.
Yep.
And we were going to get to talk about it more conversationally. So we kind of missed out on that. We can always come back and have that conversation
Sure.
for everyone.
Yeah.
And then we were also going to have a Women in Innovation panel that we were on together, and to talk about kind of riding this wave of digital health. So those topics are very near and dear to me as a person and as a professional, and then of course from a business perspective.
Sure.
But HIMSS was a bit of a hit from the standpoint of this was the time to share our brand with the world. We had press releases about our first customer. We had our product officially launched, the downloadable app. There was a lot, right? But that doesn't mean we can't come back in September. So to my point before, maybe September's the time.
Yeah.
Right. We also have a product going to the FDA in April, right? So there might be a whole lot of news in September for us to have a conversation around. So it's never an opportunity lost. Maybe it's just a little bit delayed.
I completely agree. There is a silver lining in everything. And I don't know exactly what the saying is, but there's a lot of opportunity for innovation in chaos. And
Yes.
so I think that we are going to see a lot of innovators really rise from the ashes in a real powerful way. And maybe in a way that we wouldn't have if we wouldn't have had this burden put upon us.
I think so. And I don't know the names of the company, but I did see some statistics around the companies that were born of the recession of 2008, and that they were unheard of before, or they were doing something totally different. And they ramped so well coming into and out of that recession that it made we've got quadrillion-dollar businesses out of it. So yeah. The possibilities are there.
And that's worth talking about too. It's definitely a very somber time for us, personally, professionally, as a country, and just humanity in general. So we certainly don't take anything that's happening lightly. At the same time, I do feel really strongly that there's a social responsibility for us to continue to grow and build our businesses, because they're employing people that have families, right, and lives to provide for. And that, really at the end of the day, isn't this why we all got into this, right? We want to shape the future of healthcare. We want to have impact on people's lives. And so there's a responsibility to continue doing that in whatever small way we can.
I totally agree. And that's why when I said where we started was not coming at it from a position of fear. We could have been not only immobilized ourselves, but we could have sent a signal that, that this was too scary to even approach, right?
Yeah.
And we've decided not to treat it that way. So I don't mean by that there's any levity in what I'm saying.
Oh,
And I know
absolutely.
you're not insinuating that, but
Yeah.
just for the listeners to understand that, I mean, we have a choice. We have a choice to either be terrified of it, right? Or we have a choice to lean into it a little bit. I know that's a bit of a cliche, but into it a little
Mhm.
bit and see what we can do to make a difference.
Yeah.
And I agree in the social responsibility thing. My first concern, and the reason why I focused on business continuity, my first responsibility were for the 8 people
Yeah.
that I employ, right?
Mhm.
And it's being sure that I'm doing the right things, that I don't cover up in my blanket, because there's days I want to just cover up in my blanket and go, whoo, I just need a breather.
I, I don't want to do this anymore today.
Put on a little bit of Netflix and just chill out a minute, right?
Yeah, I
But
know. What's up with all those people that are like, I'm so bored? I'm like, are you kidding me?
I mean, there are moments, right? But I believe in the responsibility piece of it, and it is time for me, and my team knows as well. I had an all hands, and I said, I want to see each of your faces, and I want you to know that what I'm about to ask, for us to pivot, for us to lean in instead of doing status quo, means you're going to be working much, much more than you did weeks ago. And that's going to have to be okay.
Yeah.
And if you tell me that it's not, then that's a conversation that we'll need to have. But we're at a point where this is going to have to be okay. And I got everybody's buy-in that, yeah, it's more than okay. This helps us mentally. This is going to help us from a sustainability standpoint as people. We're ready to go. And every one of them said they're ready to go.
You know, what's interesting is I have seen that as a real common occurrence across different companies and teams that I've worked with, is that, you know, I do one of these things where I'm asking people what their happiness score is, right? So, you know, like, what do you think about the last week, right? How did it go? Kind of
Yeah.
allows us to, as leaders, right, to be able to like have conversations about what's going on. And I am blown away by these satisfaction scores or happiness scores that are much higher than they were pre-COVID. I'm
I
like, what is going on?
I agree.
um,
We did a colored heart. So we did the
uh-huh,
rainbow of hearts, and we
yeah,
basically said, choose your heart color and tell us what that means. And yeah, they were all above average on the heart colors, and mine was probably one of the ones that were a little bit lower. Right, because I was trying to be very transparent, right? I didn't want to send out like the perfect pink heart,
right, right, right. I'm
Yeah.
great.
Yeah, exactly. So yeah, but I agree. You got to ask, you got to check in. We're all people at the core. And again, our responsibility as leaders is to ensure that our people are okay so that we can make the world better.
Yep. Yep, absolutely. And I love that you talked about, you know, doing the all hands and really being forthcoming about, hey, listen, this is what's going on. So that helps eliminate fear so people can really focus on the mission. And I think that sense of mission and purpose, you know, across the board, you know, there's definitely a lot of gratitude, you know, a lot of opportunities for gratitude along the way. You know, not being sick, you know, still being able to breathe, right? You know, for those, you know, that aren't battling that, and then having jobs to be able to pay the bills. And so I'm in this sense of purpose. Like it's like that, you know, we as human beings, we all want to matter. And, you know, it sounds like your team has the opportunity to really rise up and matter in a really big way.
Yes. And I've had those notes come to me, that say, I can't believe we have this opportunity. I
Mm-hmm.
can't believe that a company that I decided to join, that this is the difference I'm going to get to make.
Doesn't that just give you chills?
Absolutely. Absolutely. And you got to be appreciative that people do take that point of view as well.
Yeah, yeah. So what's next for you?
So we've got a lot of stuff to get lined up by summer.
Mm-hmm.
And I feel very confident that in the summertime, we will be able to launch something that has a positive impact for home care,
Yep.
home respiratory care, and drug delivery. I think what's next is to plan very well for what happens on the other side, right?
Mhm.
And just to ensure that we're doing okay as people. That's what we're up to.
Right. Yes. So, Stacie, I wanted to ask you before we wrap up here. We worked together last year with the COIQ early adoption strategy, and we wrestled through those things for
Yes,
months, didn't we?
you did.
And so, was any of that work um, pivotal in what you've been doing over the last 6 months, and then what you've been doing here in the last 4 weeks?
Yes, and the reason why is because it helps us to maintain the continuity or the plan that we had put in place. Had we not wrestled through that, and had we not put in place a plan, a very concrete plan of how we were going to innovate collaboratively across the 5 co's, right? How
Yeah.
we were going to innovate, who we were going to ask for support and help, right? And partnering was one of the categories that we went through quite heavily and did a whole report out on it.
Mm-hmm.
And many of the things that we discussed have shown up in, well, I'm going to make a personal phone call to this CEO, or
Yeah.
I'm going to reach out on LinkedIn to this particular influencer and have a conversation with them. And had I not made that list with you, and
Mm-hmm.
had I not gotten that concrete about what our strategy was going to be, I would just now be thinking about that. Who am I going to call? Which CEO am I going to send an email to? I would still be considering it rather than just making the phone call.
That makes my heart so happy.
Yeah, it made a huge difference. And will we go back to our primary customer, our primary early adopter? Heck yeah, we will.
Right,
We
right.
will. Absolutely. Absolutely.
Yep, absolutely. That's great. So, any words of advice before we wrap up for the fellow entrepreneurs who are in the trenches, maybe at different stages than you, but nonetheless in the trenches with you?
I would say just do your best. Just come at it from a place in your heart where you're making a difference for people. Be sure that you're taking care of yourself and the people around you, whether that's your family, whether that's your friends or your employees. Be sure that you're reaching out and asking each other how you are, and just focus on the fundamentals. Be sure that your business can continue. Be sure that you understand the financials of your business, and be sure that anything you do during this time, you'll be proud of, and that you know there's going to be at least a net positive. It might not be a gigantic
Right.
positive, but there is a net positive over what you're going to do for the next however many weeks.
Well, thank you so much for sharing your wisdom with our listeners. I always enjoy chatting with you when we're on camera, when we're off camera. You're brilliant, and I love to hear all the success. And I'm really excited to continue this journey with you and see how AireHealth is going to continue to help the world.
Sounds wonderful. Thank you, Dr. Roxy.
Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.